Hello, have you tried to get pregnant, and would you like to know the tips for you to get pregnant faster? In this video today, we are going to discuss everything about how you can get pregnant faster. These are the tips for you if you would like to get pregnant faster. GERALD MASSA, the Health Educator, is the name of the channel. I welcome you, my friend. If you would like to get the tips on how you can get pregnant faster, then this video is for you. Welcome to our channel. On this channel, we talk about the ovulation calendar. We do talk about the ovulation tips, and we give daily fertility tips. So I welcome you for today's video lesson. If you would like to know how you can get pregnant faster, we are going to handle this. We are going to answer this question beginning with a very important tip. The most important tip is that when you are planning to get pregnant faster, you should get off the family planning pill. If you are a woman and you are already on family planning means you are taking some medications to prevent pregnancy. You are taking medications to prepare you for future pregnancies by taking drugs. So if you are a woman and you are already on family planning and you would like to get pregnant, then the first tip is that you should get off the family planning pill. The next tip is that figure out your fertile days. Try to understand your fertile days. When we talk about the fertile days, we are talking about those days you are most likely going to get pregnant. So if you have a cycle that has 28 days, then there are high chances that your fertile days will be from the 12th to the 13th to the 14th day. The main reason is that you need to understand, or you need to know, how to calculate your ovulation days. The ovulation days specifically are the days you are releasing a mature egg. So if you start seeing your periods on day 1, then you see your periods on day 2, and then you finish seeing your periods on day 3, then to calculate your ovulation day, you simply begin counting from the first day you saw your periods to the second day and then the third day. So what you need to do is to calculate your ovulation days. If you see your periods for these first 3 days, count 14 days. Begin from the first day you saw your periods and then count 14 days. On the 14th day, that is the day of ovulation. Remember, the day of ovulation is when a mature egg is released. And when a mature egg is released, it stays around for only 12 to 24 hours. If it's fertilized within the 12 to 24 hours, then it goes on to form an embryo, or also known as a blastocyst, which implants or attaches onto your uterine wall, also known as the endometrium. So in today's tips, we are talking about the first point. We say that you should get off the family planning methods. It doesn't matter which type of family planning you are on. You could be on the IUD or the intrauterine copper device, the one which is inserted down, the copper T, and then you could also be on the no plant. You could also be taking the pills, the combined oral contraceptive pills. If you are planning to get pregnant, then please stop taking the pills and then leave or give your body some time to rejuvenate itself, to prepare for the pregnancy that is going to come in. Because when you are taking these family planning drugs, what they do is that they go and they prevent the whole process of egg release. Family planning drugs or family planning methods, they do stop the process of ovulation. They do suppress the activities of the hormones which bring about ovulation. And these hormones, we've talked about them in our previous videos. They are two. That is the follicle stimulating hormone and then estrogen. So remember to stop taking those pills, and then you'll be able to get pregnant faster. Next is you should have sex before you ovulate. Having sex 3 to 4 days before you ovulate means that you are going to have increased chances of getting pregnant. Then next is get ready to test for pregnancy. If you are looking at getting pregnant and you have been with your partner within the ovulation days, within the danger days, then you should test at least 2 weeks after. So Gerald MASSA, the health educator, is the name of the channel. Let me know if you have any questions down below in the comments. I will answer all your questions. You can also book to talk with me privately on my website, www.geraldmassa.thehealtheducator.com. Have yourself a fantastic day. See you in my next video, and you are most welcome to our channel. Bye-bye. How to get pregnant faster with one fallopian tube. How you can boost ovulation with a simple recipe. Did you know that you can get pregnant faster with one fallopian tube? Did you know that you can boost ovulation? You can boost your chances of getting pregnant with just a simple recipe, with something very simple that you have it even in your nearby market. Yes, in this video today we are going to talk about how to get pregnant faster with one fallopian tube. And yes, if you are new here, you are most welcome. I welcome you to our lesson for today. I welcome you to this channel. On this channel we talk about the ovulation calendar, we talk about the ovulation calculator, and then we do also give pregnancy tips on how you can get pregnant naturally. Gerald MASSA, the health educator, is the name of the channel, and I welcome you, my friend. Stay with me, watch this video to the end. We are going to talk about how you can get pregnant faster with one fallopian tube, and how you can boost ovulation with just a very simple recipe. It has worked. It is working for many couples. It will work for you to watch this video to the end, and we are going to talk about all this after this short message. Don't leave. Thank you, my friend, for staying around. We are talking about how you can get pregnant faster with one fallopian tube, and how you can boost ovulation with just a simple recipe. So what is happening is that we shall begin by understanding the ovulation calendar. Whenever you would like to know, whenever you want to know the days you are most likely to get pregnant, remember you only have to count from the first day when you saw your periods. If you start seeing your periods on maybe the second day of this particular month, then remember you can easily get pregnant very easily. Thank you, my friend. So we are talking about how you can get pregnant faster by first of all understanding your ovulation calendar. The most important thing is that when you are calculating your ovulation day, you always have to begin from the first day when you have seen your menses. And then when you begin counting from the first day when you saw your menses, then there's going to be the 14th day. That is when you are actually going to be ovulating. So if you are a woman out there and you have a regular cycle, and even if your cycle is irregular, still you just have to pick out a particular month which is really okay, which has been consistent, and then you basically have to count from the first day when you saw your menses, count up to the 14th day. When we talk about your cycle or your menstrual cycle being regular, specifically we are talking about knowing that the menstrual cycle is divided into two phases. We have the follicular phase, and then we do also have the luteal phase. So when you have your periods on day 1, then you see your periods on day 2 and then day 3, what you need to do is basically count from the first day you saw your periods, that is day 1, and then count up to the 14th day. And on the 14th day, that is when you are going to be ovulating. That is when you are most likely to be ovulating. So what happens is that the 3 days leading to ovulation, during the 3 days leading to ovulation, there's a release of a hormone. This hormone is known as luteinizing hormone, also abbreviated as LH. This hormone stimulates the whole process of rupture. So what is happening is that when you see your menses on day 1, then there's going to be a release of a hormone known as luteinizing hormone, and this hormone is specifically responsible for the rupture of a mature Graafian follicle. A mature Graafian follicle is basically a mature egg. So when we take a look at this diagram, you realize that the whole of this is what we call the reproductive system. This is the reproductive system of a woman. It has actually several parts, but we shall talk about them in a nutshell. We have one ovary this side, and then another ovary, and then we do also have the fallopian tubes, and then we do also have the fallopian tubes attached around here, and also these ligaments which support the ovaries. So the whole of this is basically layers of tissue. It's known as the myometrium, and then the outer thin layer is what we call the perimetrium or the epimetrium, and then we have the inner layer which is known as the endometrium. What happens is that when an egg has been released, it's going to grow. When a woman has just seen her menses, when a woman has just seen her menstrual cycle, or when a woman has just seen her periods, there's going to be growth of these eggs from a very small size, and then it goes on growing until it matures. So the first stages when the egg is growing, basically this is known as, the first stages when the egg has just started growing, it is known as the follicular phase. Follicular comes from the word follicle, whereby there's growth of a small egg. It goes on growing until it matures into a ripe egg known as the Graafian follicle. The whole process of maturation, the whole process of growth of this egg until it reaches this point of being very mature, ready to be released, this whole process is supported and it is stimulated by a hormone known as luteinizing hormone, working together with another hormone also known as estrogen. But luteinizing hormone is the most important hormone here. It plays a very big role in helping the maturation and then the rupture of this mature egg. When this mature egg ruptures, this is what we call ovulation, and normally there will be semen released, and this semen can come in, the male sperms can come in, and then they can meet around here, and then fertilization can take. So thank you once again, my friend. We are proceeding with the whole process of ovulation, and we have said that when the egg has been released on the 14th day, basically this is what we call the day of ovulation, or the day when you are most likely to get pregnant. But still, the 3 to 4 days leading to ovulation, still you can get pregnant. Having talked about this, we are going to answer our question: is it possible for a woman to get pregnant when they have only one fallopian tube? The answer is yes. It is very possible. The most important thing you have to do is you need to understand your ovulation calendar, and then also you need to understand that when the fallopian tube is not blocked and the fallopian tube does not have any issues with maybe fluid inside it, then there are high chances that you can easily get pregnant. What you need to do, or what you need to know, is that the fallopian tubes should be patent, or they should be open. It is very easy for a woman with a fallopian tube which is open to get pregnant, as long as the tubes are open, and then as long as this particular woman is actually ovulating very well. So when you are a woman and you ovulate very well and you have one fallopian tube which is not blocked, then you can easily get pregnant. Though in most cases there are times when your fallopian tubes may be blocked, still this has to be confirmed by your doctor, whereby an investigation will be done. This investigation is known as the HSG, or the hysterosalpingogram. It's an examination whereby your fallopian tubes will be analyzed under a special technique, and when the report comes out that your tube is blocked, unblocking can be done in hospital. So we are talking about how to get pregnant faster with one fallopian tube and how to boost ovulation naturally with just a simple recipe. And we have said that during the process of ovulation, as long as a woman is ovulating very well until the 14th day, she can always get pregnant faster naturally. And then the other most important thing is that you need to understand how your cycle runs. You need to understand that if you are a woman and you have a cycle that runs for 22 days, then the days you are ovulating are going to be between day 6 and day 10. And then if you are a woman and your cycle runs for 24 days, then the days of ovulation are on day 8 and day 12. All together until when you reach 45 days, still the days of ovulation are between the 26th and the 30th day. So having known all that we about the menstrual cycle and then the calendar method, we are going to talk about one simple recipe that can help you get pregnant faster, and this is what we call citrus fruits. Citrus fruits are very, very important. It's actually very important because it contains lots of vitamin C, which is very important. It is very key in handling, and it acts as an antioxidant, and it basically works on free radicals in your body. But in fertility, in managing fertility cases, it actually boosts fertility because it contains a very important element. It contains a very important substance known as polyamine putrescine. Polyamine putrescine is very important because it has been known to boost egg quality, and then also it has been known to boost sperm quality. So if you are a woman, if you are a couple trying to get pregnant, make sure that you consume some citrus fruits because they do contain polyamine putrescine, and then also they do contain they actually contain vitamin C, but in this particular case the polyamine putrescine is very, very important because it boosts sperm quality, and then also it boosts egg quality. We have been talking about how to get pregnant faster with one fallopian tube, and we have said that you just have to make sure that the fallopian tube is not blocked, and then you should be ovulating very well. If you are not ovulating very well and the fallopian tube you have is actually blocked, then it may be a bit difficult to get pregnant faster. The other thing is that how to boost your ovulation basically faster. You basically have to go on and then take lots of citrus fruits because they do contain polyamine putrescine, and then also polyamine putrescine has been known to boost sperm quality and egg quality. According to a study which was done by Dr. Murphy, polyamine putrescine is known to boost sperm quality and egg quality. GERALD MASSA, the health educator, is the name of the channel. I welcome you, my friend. I thank you for staying with me for this while, and I hope you have learned something in today's video. What you need to take home is that you should take lots of citrus fruits if you are a couple trying to get pregnant, and then the next thing is you should know that you can get pregnant easily even if you have one fallopian tube, as long as you are ovulating well, and then as long as your fallopian tube is open. You can connect with me on my WhatsApp numbers. They are just around the corner down here on the right side. You can connect with me in case you have any questions. Also remember, what is a baffling cyst? In this video today we are going to talk about the baffling cyst. Hello my friend, I welcome you to our channel, GERALD MASSA, the health educator. On this channel we talk about the ovulation calendar, we do talk about the ovulation calculator, and we do answer all your questions in regards to women's health. Ask all your questions down below in the comments. I will answer all those questions personally. Remember to subscribe so that you watch new videos we release every day. I welcome you, my friend, for today's lesson. Welcome for today's lesson. Be attentive, watch the video up to the end, and you are going to benefit a lot. Would you like to get pregnant faster? Would you like to get pregnant naturally? Then this video is for you. by the end of this video, you are going to know what a Bartholin's cyst is and what is a Bartholin's cyst and how best it can be treated. So without further ado, we shall define a Bartholin's cyst, and we shall say that a Bartholin's cyst is called a duct cyst, and it is a fluid-filled sac just inside the opening of a woman's vagina. So what is happening is that when you are a woman and you have a small swelling which is filled with fluid just inside at the opening of your private parts, then this could be a Bartholin's cyst. So we are going to look at the symptoms of a Bartholin's cyst. You may feel a soft, painless lump. This does not usually cause any problems, but if the cyst grows very large, it can become noticeable and even uncomfortable. So you may also feel pain in the skin surrounding the vagina, that is the outer skin known as the vulva, when you walk, and then even when you sit down, and this pain increases when you have sex. So the first symptom is that you are going to feel a soft, painless lump which is just at the opening of your vagina. The cyst can sometimes affect the outer pair of lips surrounding the vagina known as the labia majora, and specifically one side may be very swollen. If the cyst becomes infected, it can cause a painful collection of pus known as abscess to develop in one of the Bartholin's glands. Signs of an abscess include the affected area becoming red, swollen, tender, and even hot. Remember to subscribe for new videos we release every day, and in this video today we are talking about the Bartholin's cyst. So if you are a woman and you have a high body temperature ranging from 37, 38, even going to 39, and you have a small swelling just at the opening of your private parts, then this could be a Bartholin's cyst. Remember, if the temperature is rising, it means that the infection, or it means that the swelling is becoming septic, or it is actually getting microorganisms multiplying and going into your bloodstream, and you should see your doctor immediately if you are a woman and you have a small swelling just at the opening of your private parts. So small Bartholin's cysts are sometimes found during a routine cervical screening test. This could be a test for cancer, but still your doctor or your midwife will see a small swelling just at the opening of your private parts. This examination may be carried out for another reason, but just as they are examining you for maybe cancer of the cervix, they may discover that you have what we call a Bartholin's cyst. Next is that you can also develop a lump in the area around your vagina, so the diagnosis has to be made by your doctor. In some cases, your doctor may recommend that you have a biopsy whereby a small piece of tissue is got from that swelling using a special needle known as a Finac needle or a fine needle aspirator. It is very important for this to be taken, because sometimes you may think that it is a normal thing, but you may actually think that it's not really harmful, but it can easily develop into something as serious as vulval cancer, also known as Bartholin's gland cancer. What are the causes of Bartholin's cysts? What are the causes of Bartholin's cysts? The Bartholin's glands are a pair of pea-sized glands found just behind either side of the lips of your vagina. So these are a pair of pea-sized glands, meaning that they are just around the size of pea, that is PEA. So they are just the size of that pea, and when I talk about pea, I'm meaning these peas which are actually cow peas, these peas which are eatable. So Bartholin's glands are around that size, that is PEA. So what is happening is that the glands are not usually noticeable because they rarely become larger than 1 centimeter across. The Bufferlin's gland secrete fluid that acts as a lubricant during sex. So the main function of the Bufferlin's glands is that they secrete fluid that acts as a lubricant during sex. The fluid travels down tiny tubes called ducts into the vagina. If the ducts become blocked, they can fill with fluid and expand to form what we call a fluid-filled cyst, also known as the Bufferlin's cysts. It is often not known why the ducts become blocked, but some cases are linked to STIs or sexually transmitted infections, for example, chlamydia, gonorrhea, and even other infections brought about by E. coli or Escherichia coli. How are Bufferlin's cysts treated? If you do not have noticeable symptoms, it's unlikely that you will need treatment. So in this video we are talking about Bufferlin's cysts. We have talked about how they present. We've said that they are normally, they begin from the Bufferlin's glands, and the Bufferlin's glands are around the size of P, that is PEA, cowpeas, and then normally when they get blocked, then when they do get blocked, then it means they are going to be filled up with fluid, and this is what we call the Bufferlin's cysts. If the cyst is painful, your doctor may recommend some simple self-care measures, such as soaking the cyst in warm water several times a day for 3 to 4 days, and taking painkillers you can buy from your pharmacy or a nearby hospital. If these painkillers do not help relieve, if you apply the warm compresses and then you do even take the painkillers like acetaminophen and they do not help, then several treatments are available to treat the Bufferlin's cysts. So it is very, very important that when you have a Bufferlin's cyst, you should be able to get treatment, and the best way of preventing Bufferlin's cysts is that you should practice safe sex. That is, you should use a condom whenever you have sex, and also you should be having sex with only one person who is trusted. Thank you once again, my friend, for watching our video. GERALD MASSA, the Health Educator, is the name of the channel, and in this video today we have talked about the Bufferlin's cysts, and we have said that these are swellings which become of the Bufferlin's glands, and normally they happen due to blockage. I welcome you, my friend. Thank you for watching today's video. Remember to subscribe if you are new here. Remember to check our videos. Tomorrow we shall be releasing more videos at exactly 17 hours. Thank you for today's lesson, and have yourself a fantastic and healthy day. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, GERALD MASSA, the Health Educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. To subscribe for new videos we release every day. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, GERALD MASSA, the Health Educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.